turn left on East US 40.
This is Dublin?
2.6 miles.
2.6?
I don't know if we're in Dublin yet.
I went to Dublin, Indiana, and to hold a meeting that focused really on the concerns people have, their own personal experience with our healthcare system.
Hello.
It was one of the thousands of community discussions we had all over the country in all 50 states. We met in a firehouse. So they moved the trucks out, they moved the ambulance out, we sat in the fire bay and talked healthcare for 2 hours. It was a very eclectic group. You had doctors and you had volunteer firemen. You had people that had no health insurance and you had people that had health insurance.
30 years ago when I started practicing medicine, we practiced good medicine based upon what was appropriate, medically, legally speaking. It didn't really matter. You just practiced good medicine and everything was fine. Nowadays, that's dictated by the insurance companies and Medicare on what's good medicine based upon on the financial availability that they have. And it's not necessarily good medicine, even though it's financially inducing for them to make those kind of rules.
I listened to doctors who were very frustrated about the pressures they were feeling and the frustrations they had.
I think the insurance companies will just about claim that anything's pre-existing. We even had one day hold up a claim and hassle the daylights out of us because the patient had a cold. They'd had a cold last year, and that was pre-existing.
Joe, what percentage would you say of people who walk in your front door have problems of that kind?
Now, I would say probably 25%.
Really? One out of four?
1 out of 4 have that problem.
And where do they go when that happens?
Usually to the emergency room. We're the only doctor in a 20-mile radius. Either we see them free or they have to go there.
The day after I went to Dublin, Indiana, I was in the southeastern part of the District of Columbia, our nation's capital, at a senior wellness center where we had the opportunity to talk to some senior Americans, and they shared their frustrations and their concerns about what it is to be older and to have to deal with the many, many challenges in healthcare, even though we have Medicare. So that was an entirely different experience.
You know, we're just like a car. You know, the car gets 100,000 miles, free maintenance. Now, as we get older, this is the time when we need maintenance. Why is it that when we go to Medicare, we're finding that we got certain problems Medicare don't want to cover? That's just a question.
They emphasized a couple of things. One was the need for better nutrition. But if we take that personal initiative, especially when it comes to wellness, that we can go a long way.
All of us have to be responsible for everything. So I think that's, along with the doctors, it's not just the one thing, doctors and money and all this. We all have to do something. It's really and truly up to us.
If we can encourage people to stay healthy, they're not going to get as sick and their costs are not going to be as high.
And I am at the end point of the medical system when it comes to diabetics who get into difficulties with blood vessel blockages and gangrene, those types of things. So by the time they get to me, there's been 20 years before that where prevention could have been a viable option, and perhaps they wouldn't need to see me at all. But that's not our system.
Whether it's the cost of drugs, the cost of insurance, the cost of health care, the out-of-pocket costs and trying to get good preventative care, the costs are something that people are very concerned about.
I had a physical exam when I was 40. I'm 53. It cost me $1,000 to be told I'm okay. I'm not going to do that again.
When you think about seeing a doctor, has anybody chosen not to see a doctor because you just didn't want to pay the bill?
And I listened to people who said, I had to make a choice between drugs and groceries or drugs and rent.
I had cancer once before, and I recently had it again, but a different type. And the medication was $35,000 a year.
$35,000 a year?
Which is, if you divide that by 12, that's more than we get for Social Security.
So what did you do?
Canceled the medicine.
You canceled the medicine. And then what happened?
I'm still here.
I heard these stories, and at first your inclination is to be deeply hurt that people have to experience the remarkable degree of anxiety and pain that they've gone through. But what's inspiring about these stories is that the American people still believe and they still are committed to overcome these challenges. And that resiliency is such a powerful force.
Spend all your time in small towns, but this really does a lot to at least buoy hope.
Thank you. Thank you, Dr. Ducey.
As Nelson Mandela once said, many things seem impossible until they are done.